Broadcasting from the Paddock Mall Studios, this is WOCA, Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM, The Source.
So I think I was in the 7th grade in what would it be, 67? Yeah, I think it was 1967. I was in 7th grade. I think so. Okay, so in 7th grade, all of us boys had to have a health class. I'm sure you girls had the same thing for girls, right?
Yeah.
And back in those days, they didn't have, they had projectors, but in this case, they had a screen with the male physical stuff on the board. And of course, even at 62 years old, I still giggle at this, but the teacher had a pointer, a physical wooden pointer, and was pointing to the different parts and teaching us what they were, what they did, how to take care of them, and what to expect, blah, 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 blah. Do you know, unless I just wasn't paying attention, I never remember that teacher pointing to something and saying, "This is the prostate."
Yes.
I don't remember that. I don't remember that. So then as I'm getting older, all of a sudden everybody knows what a prostate is. And I said, did I fall asleep at that part? Did I fall asleep? Am I alone in not knowing what this is? And of course, I'm not just learning right now, but obviously this is an important part of our bodies as male specimens of the human race. Dr. Bruno Nahar is on the phone. He's a pioneer of focal therapy for prostate cancer. He's a fellowship-trained clinical instructor at the Department of Urology at the University of Miami, and he's talking about malignant conditions of the prostate, kidney, and bladder, and he performs both MRI, U.S. fusion biopsies, and high-intensity focused ultrasound ablation of the prostate. Thank you for having that in writing. I could have never just uttered that out on my own. Dr. Nahar is talking about the new high-intensity focused ultrasound treatment for prostate cancer and how men can avoid living with cancer. We don't need to anymore. We don't need to be the embarrassing thing of needing to wear diapers and that kind of thing. And nobody wants to talk about impotence. Everybody likes to be potent. Nobody wants to be impotent, right?
That's right.
We want to be important, not impotent. Dr. Bruno Nahar, good morning, sir. It's an honor to have you on our show.
Oh, good morning, Larry and Robin. Thank you for the invitation, and it's a pleasure to talk to you today. I'm very excited to discuss this new technology to treat prostate cancer.
What? Yeah, okay. Let's just jump into that. What does it do that is different from what used to be done?
Well, when you're diagnosed with prostate cancer, there are basically two treatment options, right? And that will depend on how aggressive the disease is. But basically, patients can just monitor the disease without any active treatment, or they can undergo more radical treatment, including surgery to remove the prostate or even radiation therapy, for example. Monitoring prostate cancer, by the way, we also call it active surveillance, is safe, but there's also always a risk that these patients might eventually need some type of treatment down the road. I'd say about 40% of these patients will need. And surgery or radiations, they provide excellent cancer control. They're very good in that. But they are also, like you said, associated with side effects that could be devastating to men, especially urinary leak and erectile dysfunction, for example. And now we have this new technology, the high-intensity focused ultrasound, is becoming more and more recognized, and it's growing in popularity. And I guess it is a very good option for patients who want to treat their cancer, but with less side effects compared to traditional treatments.
So do you have the men who've been told to just keep an eye on it? Because we've heard, all right, you're going to die of old age before you die of cancer. Do those men with this new technology say, you know what, I'm not going to have it, I'm not just going to keep an eye, I'm going to have it taken care of?
Exactly. So the whole idea behind, that's what we call focal therapy. So instead of treating the entire gland, the whole gland, we just treat the disease part of the prostate, only the area that has cancer. So and by doing that, we minimize the risk of side effects that are so common to radical treatment, right? Just to give an example, so there are some nerves that run along the prostate and they are responsible for the erections. So when you do surgery or even radiation, there's a high risk of injuring those nerves, and that would eventually lead to erectile dysfunction down the road. Also, the urinary control, so urinary leak. We have two control valves. One is inside the prostate, and one is outside, and they are responsible for our urinary control. When you remove the prostate, you remove that one of those valves as well, and the remaining one might not be strong enough to control the urine. The good thing with HIFU is that since you're only treating that segment of the prostate, these risks are significantly less. So,
is this available in Ocala, or is it only in Miami, or is it everywhere?
Well, I'm not 100% sure, but patients who are interested in HIFU, what they can do is they can check the University of Miami website for more information. But there are two companies that produce these machines, and then you can find all the doctors who are doing it on their webpage. And so just Google it, and you'll be able to find them.
And you said HIFU, HIFU, is that right?
That's correct.
Okay, HIFU, just for the listeners, I wanted to repeat it, and that stands for High Intensity Focused Ultrasound, HIFU.
And doctor, I think by you going public with this, that you're going to help alleviate the fear that any man has about going to the doctor and being the one to bring this up instead of the doctor bringing it up.
I totally agree. So I think HIFU is actually bridging the gap between these two most common treatment options, like just watching the cancer and being more radical. And the good thing about HIFU, like I said, it's a less invasive procedure. You're not burning any bridges. So let's say by any chance the HIFU is unsuccessful or cancer returns. Patients, they would still be eligible for a repeat HIFU, surgery, or radiation therapy. So basically, they would still have the same options they had at time of diagnosis. This is a very important message.
Okay. How is it administered? I guess is that the right word? I mean, do you have to actually go in to the body, like with a device, or does it go through the body? How does it work?
Yeah, so HIFU uses this focused ultrasound waves to destroy the tissue. So we deliver those waves through an ultrasound probe. When a patient they are diagnosed with prostate cancer, they usually undergo a biopsy. So it's very similar to that probe. There's no incision, no blood loss, and the procedure can be performed under general anesthesia or a spinal block. Usually it lasts about 1 to 2 hours. The patient goes home the same day with a catheter that stays for a couple of days. Recovery time is very short, and the function outcomes are very good. So patients usually do very well after HIFU.
And they can feel that they're in good hands with this form of treatment since you are a pioneer of this type of therapy.
Well, that's correct. So HIFU was approved. It's been out for a while in Europe for about 20 years, but they've been doing like whole gland treatment. But it was FDA approved in 2015 in October, and since then we've been doing this on a regular basis. But a very important message is that HIFU is not everyone is a candidate for HIFU. So the size of the prostate matters, the location of the cancer, and the volume of cancer. These all play an important role. So it's very important for you to discuss with your urologist whether you are a good candidate for HIFU or not.
And what type of discomfort does the man feel that will give him the warning signs that there might be something wrong there, that he should have it checked out?
So that's the problem with prostate. So prostate cancer is a little bit tricky because usually there's no symptoms. That's the problem. So you do the PSA, which is a biomarker, a blood test that you can do. And if the PSA is high, or on the finger exam you feel something, then you undergo a biopsy. And based on that biopsy report, the biopsy is going to tell you whether or not you have cancer. But the numbers are a little bit scary. So it's the second most common cancer in the U.S., and 1 out of 7 men will be diagnosed with prostate cancer at some point during their lifetime.
Oh, wow.
So it's very important that you see a urologist, yes.
It does.
Not everyone will have aggressive cancer, but any cancer, yeah.
Does prostate cancer typically what's the word, metastasize, or does it not?
There are different types of prostate cancer, So most prostate cancer are low risk. They usually won't metastasize, and that's why we offer the active surveillance, just watching it. But we want to make sure we don't miss the aggressive type.
And do you always encourage involvement of the partner with these decisions? Because sometimes the men want to take care of it themselves and not let anybody know.
Yeah, I agree. This is very important. Usually, it's the wife who brings the patient to us. So it's very important to discuss that, give all the available options. And I always tell the AUA, the American Urological Association guidelines, recommend the screening for men between 55 and 69-year-old.
Oh,
but
okay.
if you have a strong family history, or also an African American, which is more common, you should start it sooner.
Okay. Doctor, thank you for the information. We've recorded this, so we'll put this up as a podcast. What I wanted to tell the listeners, if you wanted to know more, I did Google it, and just do that, and you'll be able to find out the information you need. And looks like Medicare now covers this as well, so that's good to know. Right?
Yeah, that's correct. Now, Medicare is actually covering the hospital component of it, so
okay.
the surgeons and the anesthesia team will still charge on top of this. But I think this will be corrected within the next 2 years, so it should be fully covered by private insurance company as well.
All right. Call us if you need any of that repeated here at the radio station. We'll be glad to help you out. Dr. Bruno Nahar, thank you for what you're doing with your life. Thank you for your work and for taking time out of your day to be with us today.
Oh, thank you very much. The pleasure was mine, and thank you again for giving me the opportunity to talk, and I'm looking forward to talking to you again.
Absolutely. Thank you, sir. We will be right back.
Veterans Day in the U.S. is also known as Armistice Day in other parts of the world, and it honors the many military who have fought for freedom. It is also the anniversary of the signing of the armistice that ended World War I. Major hostilities formally ended at the 11th hour of the 11th day of the 11th month in 1918. The folks at the Voice of South Marion join you in remembering military